Welcome to All Things AI. My name is Ishan, and in the 10th episode of the All Things AI podcast, we have Dr. Mohsin Bilal, an associate professor of AI and data science and an applied AI researcher whose work is primarily centered around developing effective AI to solve real-world problems in the medical industry. Welcome to the channel, and it's an honor to have you here today.
Thank you, Ishan. It's nice to be on your All Things AI.
Yeah, so it's early morning around 5:30 here in Cleveland, so I'll just start off by asking, I guess, how's your day been going?
Yeah, it's going fine so far, just like any other faculty day in an office.
So I guess with that being said, we can move into the first portion of today's interview, which will focus around AI and digital pathology. So after following a bit of your work, I realized that a lot of it revolves around digital pathology and its implementation through AI. So we've seen novel discoveries relating back to AI in recent times. And I was wondering, just in pathology, I guess, what is something in recent times that you think is a groundbreaking discovery, especially honing in on pathology and cancer detection through AI?
Yeah, this is a great question to start our discussion on AI and digital pathology. There have been a lot of development over the past couple of years in this sphere on AI for pathology. One of the most interesting aspect of pathology and AI is analyzing routine histology images. And we have seen over the last couple of years, there have been tremendous research in this area where people were using deep learning algorithms to predict molecular alterations or genetic alterations from routine histology slides. And though it is usually not used to predict or to determine this status from routine histology slides in the clinic. There are other ways to do that, like immunohistochemistry and PCR-based testing. This is very crucial to determine that what are different genetic traits in our population of patients. And if we are able to predict these genetic traits, or we can separate patient cohorts based on genetic alterations, it can not only save a lot of cost, but it can, more importantly, can save time to start the treatment of the patient. So that is one of the reasons that I consider this one of the groundbreaking discovery of application of deep learning in digital pathology. We can call it pre-screening AI, and it has been used for other purposes, like we can use AI to filter out normal slides or normal patient biopsies automatically without the need of pathologists. And another aspect that I would like to mention here is the transformative potential of AI. Especially, there are several companies now where very interesting work has been in progress. For example, Page AI is an clinical AI company where they are developing diagnostic solutions using AI and digital pathology. Okin AI, where they are trying to make AI for precision medicine, and a recent development in one of the lab where I have been working previously in the University of Warwick, a spin-out company they have made with the name of Istofy AI, and their motto is evolving their research and development around interpretable AI, which is another very fascinating aspect in this field.
Yeah, and so the two things I guess I really caught on to was one of them was cost effectiveness, and the other thing was, I guess, automatic diagnosis. So, because those really tie into the next question I want to ask, which is what's the broad impact of using AI in pathology? Like, I guess, is it faster or more effective for timely diagnosis?
Yeah, true. It has AI in pathology has a broad and transformative impact. One of, as you mentioned, two key areas where we can get improvement in clinical workflow. First of all, based on some efficiency that AI can bring in, as well as speed up in diagnosis. Other than that, there is another very interesting area where we have seen a lot of development. For example, understanding or basically mining visual and sub-visual patterns from histology slides using AI that can help to improve the diagnostic accuracy uh, for any clinical decision making, also prognostic decision making. Besides that, research and discovery potential is also great. For example, there are possibility of coming up with new patterns which can be lit up by the technology, by the AI techniques, and also it has been said in almost every paper that AI is more consistent, like the procedure is objective. We can follow the track how the decision was made. So potentially these are a couple of impacts where which can be created using AI in digital pathology.
And so next, I want to look into challenges that you faced in your time researching. So what's the biggest challenge perhaps that you faced in your time conducting research, and what did you do to combat it?
Yeah, there are several different challenges which a researcher can face. Like I started research in digital pathology as a computer scientist. So first of all, in first couple of months, I was struggling with medical terminologies. So it required a bit of understanding, bit of reading more about medical techniques and terminologies, understanding the pathology workflow, how tissue samples are prepared. Uh, Other than that, I think for a computer scientist point of view, there are a few other challenges. For example, whole slide images are usually called as multi-giga whole slide images. That means there are hundreds and thousands of pixels in single whole slide image. Like we can have 300,000 by 100,000 raw pixel data in a typical whole slide image. So to handle that large amount of data is one of the challenge which usually computer vision researcher face when they start working in computational pathology. So there are several methodologies that can be applied. For example, a very trivial one to divide the image into several patches and then process them. Or there are some opportunities to come up with new, more abstract, to learn more abstract representation of whole slide images. If you work with the patches, one of the key aspects is that most of the time, if we are working in a top-down approach, most of the time we are unable to find out more annotations in each region of the whole slide image. So then there is a role of some technology like attention and other mechanism that can help us over there. So we have developed one of the method which is like iterative draw and rank sampling, where we try to find out which regions are more informative for the decision making for the given downstream task. So there are other challenges, like once we are able to develop our technology, we have to validate it thoroughly. We should be carefully selecting the cohorts without introducing any selection biases, like having more representative data in our cohort. And also validation is very important, that we need to validate our algorithms on multi-site data so that it's unbiased assessment of the algorithm. These are the few challenges which are more relevant to the computer science researchers. There are a few challenges which, if pathologists start working in this field, like in computational pathology, so they might be looking for different software so that they can train their own algorithms, their own solutions they can make. There are many solutions out there, QPath, and one of the solutions developed by University of Warwick Tissue Image Analytics Center, TIA Toolbox. We are also developing one solution here which can help. We are trying to make a solution, a tool, basically, which can help pathologists to develop solutions for on their own without needing to learn much of the programming languages like Python and others.
Yeah. So you were talking about validation, for example, and I guess I can really connect to that because it's also a challenge when I do like independent research, for example, because I guess more than selecting the right cohort, my challenge is really selecting, I guess, a project or any data set that has enough data in the first place. So I was wondering if you faced any challenges, I guess, relating back to that, just with data availability and having the right amount of samples to validate models.
Uh, if I have been working in the University of Warwick, where we didn't find those issues, mostly because uh, there are a lot of hospitals which have been um, digitized, if not fully. So a lot of their departments are now making digital repositories. So, but there usually the challenge is that how to uh, attract more teams in more sites in our project, and also that meeting their requirements for security and privacy concerns, which is one of the reason uh, labs can, for example, be reluctant on the collaboration. In in the developing world, where currently I'm sitting, like in Pakistan, there is no digitization. So lack of digitization is one of the key challenge here in the developing world, that we don't have hospitals where infrastructure is there to digitalize their daily samples. There we face this challenge. But the good point, for example, if somebody wants to start research in this area, there are a lot of repositories available for the research on the public domain, for example, TCGA, the Cancer Genome Atlas. And there are a few others where thousands of slides are there with necessary clinical data that can be utilized to start the research, even to validate our algorithms if we are using some local cohort to develop that algorithm.
Yeah. So with that being said, I want to move on to the second portion of today's interview, which will focus around the future of AI in medicine and beyond. So one topic I think for the usage of AI in the real world focuses around surgery, for example, like an AI-powered surgery assistant. And so from my perspective, this is something that's totally optimistic because obviously it's hard to have like a surgery bot or something working off of data that we trained, especially because of the risks that this takes with it, I guess. So is this even a possibility or anything like this? And if this is a possibility, how long do you think it would be before we see something of this sort being truly implemented in medicine?
It's a very good question. I have seen a couple of papers and a couple of demonstrations where people start using different tools. For example, they call it interoperative planning or intra-operative guidance, and also some demonstration on surgical robots, which are there. So I would say it's not just a possibility; it's now becoming a reality. And if we talk about digital pathology sphere, as I mentioned, Page AI, one of the clinical AI company, they have FDA approved solution of detecting prostate cancer, which is actually a companion algorithm. So that is also, we can say, is going to be a reality, that we are now seeing more of the work where people are interested to develop tools which are working as an assistant to the human expert, because the goal here is not to replace human experts, because no technology can replace human expertise. So instead, the goal is to assist human experts so that we can benefit our patients more than before.
Yeah, so I guess building off of that in a way, and not just like surgery, for example, but having AI being implemented on a day-to-day practice in the healthcare system. So what roles might AI play in day-to-day healthcare practices, diagnostics, or even patient care?
Yeah, in day-to-day healthcare practices, AI can be used, as we have already mentioned, that some very novel aspects of AI application, like pre-screening AI, is something new for the clinical workflow that we can introduce. Another step before doctors see the specimen, AI can be employed over there to, for example, automatically report normal cases, or to find out some group of patients which can benefit from some of the tests, like for microsatellite instability, which is one of the biomarker for immunotherapy, that which of the cohort separation or group of cohort patient may not benefit from immunotherapy. So we can select those majority of those patients using AI. So this is more around diagnostic workflow where AI can be applied. Similarly, for prognostic risk assessment, assessment about the effectiveness of the treatment can be done using AI. So these are more related towards the expert task. We have seen a great development, especially recently when generative AI got developed, for example, ChatGPT and other foundation model, not only in natural language processing, but also in computer vision. And now we have seen many work with where people have developed a foundation model for histopathology image analysis as well. So we there the claim is that AI can be used for those common tasks for which it is not specifically trained. For example, answering questions and discussing on some particular topics, or maybe scheduling for meetings, or maybe answering some emails and helping those people who are doing some clerical work in the hospital. So there are many such applications which are now considered as being automated using AI.
Yeah. And I think that definitely connects back to just AI in our real life, for example, because anything we see probably has like even like not anything, but at least a lot of things that we see probably have like even a little aspect of AI implemented in them that speeds up how processes work. But I guess with that being said, and with AI getting more powerful, it's important to move on to the next portion, which is just going to be a quick one focusing on an AI policy. And I want to see how AI policy can play a role in healthcare, because I guess for me, one of my biggest interests in AI is how can we regulate it, and exactly what should we be doing to control it so that it doesn't get out of our hands. So my only question in this segment is, how should AI regulators focus on placing restrictions on the usage of AI in healthcare? And could AI in healthcare be potentially dangerous?
Yeah, it's another very timely question. Nowadays, it's a buzz question around generative AI. I would take it. The role of AI could be separated into at the phase of implementation and integration of AI in real world scenarios at two different levels. For healthcare, for example, one level is development level and then implementational. So at the development stage, I think there should be no restriction to what kind of AI should be developed for healthcare, especially, so that we want to, as we have seen, for example, predicting molecular pathways or genetic alterations from histology slides, which is not usually done by pathologists, is very ambitious and something which might not have been thought by many researchers, many leaders in AI and pathology. But eventually we were able to do that because we can confidently now say that those algorithms are now giving accuracy above 95% in terms of AUC. So that's very fascinating. So on the development side, I think there should be no restrictions. We should allow and encourage research, development to make new solutions, to make new algorithms from large data available from the clinic. But on the implementation side, before integrating those technologies, rolling out those technologies in public, there should be some criteria, some restrictions, like more rigorous evaluation, whether the regulatory requirements are met by that algorithm or not, more rigorous validation, multi-centric validation is important because we want to avoid biases. We want to have a fair AI. We don't want an AI algorithm working on some particular segment of population better than other. And also, one of the very important aspect is analyzing our solutions in terms of where they lack. For example, where the algorithm is not very confident, like error analysis of our algorithm, so that we can guard against those errors when we deploy such solutions. And another aspect is on the explanation of the decisions. If AI is making decision, it should be transparent, interpretable, and explainable at whatever level we can extend it. This would also allow us to be more accountable towards AI, like having awareness about the solution capability and its limitations, so that we can find a particular niche, like we were discussing about pre-screening AI, which is a proposal of a new step in clinical workflow. That is a niche where we can deploy AI with very limited risks. So risk assessment is very important in that case. So I think these are a few areas where we should be more, for example, more careful in claiming and in evaluating our solutions.
Definitely agree with that. And I think AI regulation in general will play a much bigger role going on into the future, because we've clearly obviously seen with ChatGPT how powerful it can get. And that almost just scares people, I guess, in a way. But yeah, with that being said, I want to move on to the final portion of today's interview, which is just advice that you can provide for young innovators, like even myself, who get involved in AI research. So I guess, how should teens really get started with AI research if they're not currently involved in it?
Another very good question, and a very favorite one. Being a faculty, these topics are usually discussed when we have to present something to our students. Uh, I would divide into three different areas. At first, there is a need to develop your expertise and skill. For example, programming languages. Python is in for AI nowadays, so there are plenty of tools available, free resources where students can learn how to program in AI and how to program a complete machine learning or AI algorithm. Second stage is when we start, we have enough expertise in language, we can work more on AI side to develop. The students can work to develop. Students can develop their fundamentals, to make their foundations of machine learning and AI more sound. Next stage is don't just stop over there. Try to engage in some project. Maybe it's a competition or some work that you are motivated to do. For example, as I mentioned, there are few repositories available of pathology slides, which can be used for developing your research algorithms, your models. And if you are more keen towards publishing your results, preprint servers are there on bioRxiv or medRxiv, even on arXiv. One can publish there, and also making team, like there is this is a multidisciplinary domain where single, for example, expertise is not enough to get something more tangible, some interesting finding. One needs to be engaged with some pathologist or oncologist and get their, for example, annotations or opinion about your results at time. So I think these are different areas which can be considered as different places where students can start their.
Yeah. So the final question I want to ask you is just maybe like something that you would say, or if there was one thing that you wish your professor or someone else important to your journey told you before you started this whole process, maybe like a few years ago, what would that be? Like, I guess some words of motivation, for example.
Yeah, very good ending question. Uh, I was lucky and fortunate enough that I had very good professors, very good mentors, which made me to stay motivated during my research. So research is, for students, I would say that research is a marathon, not a sprint. So one has to develop some skills so that they can enjoy the process. For example, being passionate about your research project, uh, being persistent in their work, consistent in their work, so that you and also it's failures are very common in research. Those are actually not failures; those are steps. If you break down your goal into multiple deliverables, so those are deliverables. So even take each failure or each setback as a deliverable that is not only achieved, it would definitely help you to learn something new. And patience is also required because it takes time to reach to something where you can show to the world what you have achieved. It takes time, but the reward is great. So I think with persistence, consistency, passion, and patience, they can thrive.
Yeah, and I'll keep that in mind myself when I guess, progress with my science fair project this year. But yeah, that's about it for today. And thank you so much for joining us.
Thank you, Ishan. Nice to have discussion with you.
And for anyone watching this later on, make sure to leave a like, subscribe, and comment down below.